So this webinar will be recorded and archived. It will be made available at a later date, and an announcement will go out when that is available. Following the session today, we will be sending out a survey and look forward to your feedback. And in that survey is also the information that you'll need for your continuing education units, credits, and your CRC credits. So we are offering both of those at no cost to you today. And handouts will be in that survey email as well. So what I'd like to do now is introduce our speaker, DeLeana Strohl. She is a professor with the Rehabilitation and Counseling Program at the University of Wisconsin-Stout. Known DeLeana since 2008 when she moved up to the Northwoods and joined us. So we are excited to learn from you today about cultural competency and trauma-informed care. So welcome and thank you, DeLeana.
Thank you, Laura. Well, hello, everybody. I guess I hope this finds everybody well, since this tends to be our now new method for getting any kind of training in CEU credits. I kind of like both of these topics. I like both of them individually, so merging the two was a nice challenge that I accepted from Laura. And I think obviously it's perfect timing in terms of what's happening in our world today. So I do hope that you find it somewhat informative. My guess is that most of you, if not all of you, have already an understanding of both of these topics, and to some degree even a merging of the two. But if you're anything like me, once we experienced the George Floyd murder, I went on an even deeper exploration of taking a peek at my own viewpoints and biases and privilege and such. And can't say that it was a fun process, but it was a very valuable process. The day after the George Floyd murder, I launched a multicultural counseling course for Stout students. Needless to say, it was a very intense, emotionally elated experience for everybody. As we watched everything that was happening and such. So my guess is also that you will not necessarily agree with everything that I will talk about today, which is absolutely fine. All that I ask as I go through and we kind of talk about this merging of these two topics is that you just stay open to the data, monitor how you respond to it, what you like about it, what you don't like about it, and ponder it a little bit and see where you end up in terms of what I'm going to be requesting or asking you to ponder and to think about as we merge these two topics. And also keep in mind that as we talk about any topic, especially when there might be a level of trauma attached to it, that you might have an emotional reaction to it. So if you find yourself in that camp, then make sure that you do what you need to do for you. So, okay. I am going to launch and share my screen with you. Laura, it says only the host can share.
Okay, let me.
Oh, there we go.
You see it now?
I do see it now.
Looks great.
Okay. Okay. Just making sure everything's working here. Okay, so. All right, so the learning objectives, we really want to kind of focus a little bit on understanding some cultural variations and how some different individuals within cultures might view trauma and sometimes the trauma responses. Understanding the importance of the historical trauma and historical narratives, and also recognizing how your role might be viewed by individuals that you might be serving that are culturally distinct from you. And one of the last topics that we will talk about is understanding the importance of resilience as any protective factor for helping somebody recover and start some healing processes or continue down a healing process. Part of the main focus will be talking about possible strategies and considering how cultural impacts your trauma-informed practices already. So, as you might imagine, merging these two topics together will narrow down a few of the topics that they both intersect with, but I am going to assume that as an audience member, most of you, again, if not all of you, have that foundational knowledge and understanding of trauma, because understanding trauma is one of the top priorities and principles of understanding trauma-informed care. So I'm not going to really talk about trauma per se, except in that historical factor. So some of the data that you will receive after this presentation will include a little bit more of that. And we'll briefly talk a little bit about some cultural competence, and then a little bit of that intersection of trauma and culture, and a little bit of that trauma-informed care, but the main focus is going to be some of the main principles of how that cultural competence is really going to impact your practice right now, and how you already engage in trauma-informed care practice. So I think it'll make sense as we keep moving. So, and yeah, I think you're able to ask questions if you have any. So I want to start off with a few definitions so that we're kind of all refreshed in terms of how we might be viewing this thing called culture and all the other topics. Culture is that integrated system, and it's really that learned behavior that members gain from the society, the environment that they live in. For some individuals, it's a total way of how they interact and intersect with the people within their environment and communities. It does include everything that a group of people might think, what they tend to say, and what they make. It's all involved in systems, attitudes, and certainly feelings. One of the main reasons why I kind of like this definition, because there are so many out there, but that culture is really learned and transmitted from generation to generation. And I think oftentimes we don't always stop to think about that. We always kind of know it, but we don't always necessarily stop to think about that. And I think sometimes it's often hard to do that when you're just working with an individual in front of you. And so really truly understanding how trauma can be, or culture is passed from generation to generation, is going to help with that intersection of how trauma can also be passed from generation to generation. The other piece to that too is that because of that generation to generation passing on, earlier generations may not have direct knowledge of some of the aspects of the culture that they have been given by their ancestors. So some of the folks that you serve might hold on to some cultural beliefs that they don't 100% completely understand, or they might throw some of the cultural values away, but still feel a little disconnected from some of the values or some of the people within their own community. Promoting again that everything that we're still talking about, and when you're working with individuals, everything revolves around how that individual perceives who they are. Again, assuming you really also recognize trauma, want to just at least, let's define trauma a little bit here. So individual trauma is going to result from an event or any series of events, or possibly even a set of circumstances that an individual experiences that causes some level of physical or emotional harm and or life-threatening, that has some lasting adverse effect on how that individual functions psychologically, mentally, socially, emotionally, and even spiritually. This is a very broad definition. Some of the best work comes out of SAMHSA. A couple of, there's so many different examples. I know you guys are probably already thinking of some, but these could be accidents, natural disasters, any crime, surgeries, death, or other violent events. Also could include some responses to chronic or repetitive experiences, such as child abuse, neglect, combat violence, urban violence, violence in any household, natural disasters, I might have said that, criminal violence, fires, car crashes, surgeries, illness, and or witnessing any of these events. Parent living with a mental illness, a parent living or living with an incarcerated family member, a parent living with a substance use disorder, poverty in and of itself, and parental separation or divorce. Just a brief outline of what could be considered trauma. The beautiful piece of this, and maybe the hard part, is we don't get to determine what is traumatic for anybody. The individual gets to determine. So it's very much a subjective experience. We all as professionals tend to have an idea about what trauma involves, and sometimes we think it's these big things, and this is a broad enough definition that hopefully this is just a reminder that sometimes it's not always just large events that can cause it. Sometimes it can be seemingly smaller events that can cause enough impact to that individual. Usually that psychological response tends to produce an overwhelming sense of helplessness. And when that happens, when the event occurs, it tends to have a more lasting effect on that individual long term. Depending on what that experience is, if it involves another human, it could also involve a sense of humiliation or betrayal if it's somebody known to that person. How that event is handled in the family, community, or environment, if it's been silenced or helped, can also impact that. The developmental stage of the individual at the time that they experience the traumatic event can also impact how that person responds to the event themselves. Couple things. Most of you are professionals, so you already probably know that not all trauma is going to lead to post-traumatic stress syndrome. However, all trauma is still going to hijack the brain and the body, so that sometimes the reactions to trauma is not always in the full control of the individual experiencing trauma. But maybe one of the lesser known pieces of trauma is that all trauma leads to grief. So even if you're working with an individual that does not experience any post-traumatic stress or full-fledged post-traumatic stress disorder, they may only experience a few symptoms of trauma or post-traumatic stress disorder. Everyone that experiences trauma experiences some level of grief. And this is a really tough one because not everybody recognizes that there's a potential loss that they might experience. And so when you're working with folks, they may not have done any grief work, may not have known what they've lost. They just have these intense emotions and they don't know what to do with them. All I can tell you is there is really no safe way to suppress emotions. All suppressed emotions are going to leak out, and there's no safe way to do that. If somebody does want to suppress emotions and not manage any emotional reactions that they have, eventually all suppressed emotions are going to cause some level of distress. It could be sooner, it could be later, it doesn't tend to matter. Those suppressed emotions can leak out, or they can blow up after a certain amount of time and come out in really more negative ways. Sometimes the leaking out doesn't always necessarily cause as much harm, but there is no adaptive way to avoid emotions. That's the hard part. There is no adaptive way to avoid emotion. So at some point, emotions not processed or dealt with will lead to some unhealthy expressions of that suppressed emotion. We often tend to see that in any addiction or a lot of anger, depression, some isolation, or just that emotional numbness, and they just don't really care about what happens. And that's just a few of the options. So as we are looking at how that intersection occurs, this is just really highlighting how important it is for you as a professional to understand that the individual gets to define what is traumatic and what's important to them as they try to find a way of healing. So it is a very much a subjective experience of the trauma that they experience. And so the 3 E's that intersect with that to at some level then dictate how that person responds is, what was that event or the circumstance? I was just mentioning, when did it happen? When did it occur? How frequently? What was the intensity? So we don't get to define trauma. And so based on that event, that individual is going to make a determination of what it meant to them. And that's the only person that gets to make that determination on what it meant to them. And this is the really hard part, because we might work with individuals that experience the same thing as somebody else, but we work with 5 people that, well, they experience this, it's no big deal. They're able to do what they say they want to do, and they're able to work on goals, but the 6th person may not. So it doesn't really matter. And we as professionals, we just need to monitor how we respond to individuals when we might make some assumptions about, that's it, that's your trauma, that's all you're doing. So it's really vital that we remind ourselves that the individual gets to determine what is traumatic and what happens. And then those effects could be short-term or long-term for that individual. So even if somebody did some really good work and they was able to put some trauma in the past, it doesn't mean that that traumatic response still cannot impact them at a later date. As you know, one of the things with trauma is the body does keep the score and it never goes away. We just as individuals learn how to manage it. So when you want to intersect this with some of the culture, especially that historical or current, the cultural customs that get passed down from generation to generation, trauma is going to get passed down from generation to generation, either individually or collectively. So individually, trauma can get passed down by epigenetics, and collectively, trauma is going to get passed down by the trauma narratives. And we'll spend some time later talking about that. And just kind of like our job is to really just monitor how we're going to respond to somebody when they describe their trauma or their challenges with what they're experiencing. It's too easy for us to forget this when we go on autopilot. So part of this too is us as professionals recognizing when we are on autopilot. When we are going on autopilot, you know, your job is pretty demanding. So you kind of forget some of the things that you already know because you're task oriented and you want to get some goals accomplished and stuff. So you got to kind of make sure that when you start sensing that little bit of judgment creeping into your mind, that's a good opportunity for you to kind of take some deep breaths and make sure that you're staying focused and individually viewing your person that you're working with as you normally do. So, and keep that in some conscious awareness that when you start seeking or hearing, sensing any potential level of judgment of what somebody's labeling within themselves. I think that makes sense. Yeah. So if you just sense that, you just make sure that you stay more consciously aware. So cultural competence, you probably have experienced many, trainings work focusing on cultural competence. If we want to do the best job we can, we have to make sure that we're able to first understand what somebody might be experiencing. We want to make sure that we can communicate our understanding, because sometimes it's not necessarily that we get everything in so totally, but we've got to be able to communicate to some level or validate to some level that we can understand that somebody's experience might be different from ours if who we're working for is culturally distinct from us. And obviously it relies on some of the main principles as rehab professionals that we have anyways. Trust, absolutely respecting diversity and equity and fairness, and really wanting social justice. Part of this is going to require that we are more in tune with our own culture and worldview. And I am assuming most of you kind of was like me, that once the murder of George Floyd took over, even though all of us had some level of awareness of our own cultural worldview and bias, that we still had to revisit it. We'll talk a little bit more about that too. And it does require some positive attitudes towards those that are culturally distinct from us, and not getting maybe sucked into what other people might be saying or suggesting. And we're always striving to gain any new knowledge and of any culture that's distinct from us, and understanding some of the best practices in working with individuals and what some of their worldviews may be. And always, the double-edged sword is always going to be that there's still a lot of heterogeneity within any given culture. But you start with a framework of understanding cultural differences. And certainly using your counseling skills for communicating and interacting with others that are culturally distinct from you. We could probably talk a long time about the communication piece, especially when we get the difference between individual and collectivistic groups, but we just don't have enough time for that. So I'll touch on that briefly later on. And part of this is, moving beyond tolerance, and it really truly revolves around respecting diversity and embracing it too, and allowing others to define who they are and their own experiences. And it's so easy to say intellectually that that's what we do, because it is a huge foundation of rehabilitation professionals. But it's not as always easy to do in that day-to-day service that you provide to everybody that you provide services to. So we do have to consistently kind of double check our own presence. How present are we? Are we on autopilot? Because when we go on autopilot, we forget a lot of this, and we come from typically a point of view that is easy for us, which is our own, and we all go on autopilot. So I am making the assumption that if there is anybody out there that never goes on autopilot, I bow to you, because going on autopilot is just a natural aspect of being in a very busy professional serving a lot of individuals. And so part of what we need to do is really recognize and validate somebody's own experiences. So we've got to be able to recognize that what they're telling us is their experience, and we have to honor that. And I think a lot that's happened in the most recent months, there's too much out there that is too quick to dismiss what individuals are saying is their own lived experience. So, and we just make our own commitment to be able to find the path to be able to talk about any potential current level of trauma that somebody's experiencing, and or any potential historical trauma that might have been brought up by what's happening or continues to happen in today's world as one watches media. Trauma informed, I'm assuming most of you again have experienced some of this, but just to kind of give that brief foundation, it really recognizes the widespread existence and the nature of trauma and how it might impact individuals. It also recognizes trauma symptoms and approaches to what we as rehab professionals can do to help somebody heal with trauma. It's always going to have that intersection and integrated knowledge. We got to take all knowledge we have of trauma and culture and then incorporate it into our trauma-informed policies that your agencies develop, which involves in that service delivery of how you operate to try not to re-traumatize folks. And as you know, this is how trauma-informed care developed. We recognized that as professionals we were re-traumatizing people, not intentionally but certainly inadvertently, and that's not what anybody wants to do. And so the main focus is to minimize how much we re-traumatize individuals, and it really focuses on how every agency works at the micro, meso, and macro level. And I am assuming most of you have received some training on trauma-informed care, and that all of your agencies have some level of policies implemented. Trauma-informed care has just been around for so long. And it's one of those things that we're always going to be kind of focused on and working and improving, much like cultural competences. It's not necessarily anything that you reach this end point. It's an ongoing process to make sure that you continuous improvement. There are 6 principles to trauma-informed care: safety, trustworthiness and transparency, peer support, collaboration, and mutuality, empowerment and choice. We're going to focus on the culture issue and historical concerns. So that's really the one I want to explore the most. So that intersection of cultural competence and trauma-informed care, other than the 6 principles, there's these 4 R's that are talked about in trauma-informed care. And so just in trauma-informed care, it's kind of like part of what we already talked about, that realization of the extent of how much trauma exists, and that breadth. If you listen to those examples, it could really include a lot of the folks that you serve, and then how much that affects individuals in the short term and in the long term. Recognize those signs of trauma, and then how you respond systemically to your organization to how you serve the individuals, just so that you make sure that you reduce how often you're re-traumatizing. So now let's intersect that with culture and trauma-informed care. And so part of this realizing the prevalence of trauma individually is also added to collectively. What is it collectively about somebody that might be culturally distinct from you in the history that might have a culture or a trauma narrative attached to it? And also recognizing how trauma affects those individuals directly and indirectly by recognizing how the survivors bring to the forefront those inner and collective growth. And responding by putting cultural knowledge into practice, learning, and putting the knowledge and how the community can be pulled into the process, and how safety and well-being is important. So we'll focus much more on all of those in that intersection. So realizing the prevalence of trauma individually and historically, I think it's a pretty safe conclusion for me to make that all of you understand the prevalence. So I want to focus more on that collective nature of trauma. because I think most of your strengths is on the individual trauma, and I'm assuming there's several in the audience that also have a command of the collective nature. So especially with what our current society is dealing with, if not world, let's kind of just focus on right now, look at trauma from a collective standpoint. So in order to kind of focus on that first piece in terms of really understanding how we as rehab professionals can work at understanding individuals that are culturally distinct from us, individually and collectively and historically, we as rehab professionals need to really take a look at our understanding, our viewpoint, and our attitude towards white privilege, towards microaggressions, towards implicit bias and any cultural assumptions we have, and how we view culture and cultural differences from an ethic and emic perspective. So we're going to take a look at each of these individually. So white privilege. And I also could have put up so many different definitions of white privilege. I am assuming most of you already have some understanding of white privilege. There's several reasons why I chose this one. But basically this is from the Southern Poverty Law Center, and white skin privilege is really not something that white people necessarily do, create, or enjoy on purpose. Unlike the more overt individual and institutional manifestations of racism, white skin privilege is a transparent preference for whiteness that saturates our society. White skin privileges serve several functions, and first, it provides white people with perks that are not earned and that people of color do not enjoy. Second, it creates real advantages for whites. White people are immune to a lot of challenges. Finally, white privilege shapes the world in which we live in, the way that we navigate and interact with one another and the world. So not all of you might be comfortable hearing the definition or the description, but there are extra economic perks that come to those with white skin privilege who especially live in the middle class and the wealthy, because they tend to gain more economic benefits. Or at least privilege equals privilege equals power, and sometimes it's the economic extras. The poor and working class people of all races may not get what white privilege can do for the middle class and the wealthy. But there still are benefits that are advantageous to all white people, regardless of socioeconomic status. And they tend to gain these at the expense of people of color, regardless of whether, whatever economic position that they are in. And I know as we kind of go through this and talk about some racial benefits can stir some anger and seem false, especially to those that live in lower socioeconomic status and they don't necessarily have as many economic privileges, but those in lower economic positions do have some benefits. I'm trying to find, and we'll talk, I think we'll talk about those now. So when somebody lives in the lower socioeconomic status, it's real easy to say, yes, but. Yeah, there might be white privilege, but I haven't experienced that because I grew up poor. I don't have any privilege. And even if they're somewhere around there, even a little higher, my family has earned everything that we worked for. And or has the belief that other races get more breaks than whites do. These tend to be the three most common rebuttals against white privilege for some individuals that are white. Even folks that live in a lower socioeconomic status, as I said earlier, there still are some minimal, maybe minimal, but they still have some economic perks. So just a couple of examples. I could probably spend an hour giving you some examples, but I want to give you just a few. So 33% of white children attend a low poverty school, but 10% of Blacks attend a low poverty school. So a lower poverty school would be a school with more economic privileges. 6% of whites attend a high poverty school, but 40% of Blacks attend a high poverty school. Unemployment rates are doubled for Blacks compared to whites, which does not even include a disability. So if you add a disability into any of these stats, you're probably going to double and triple the magnitude that an individual experiences. Whites tend to be hired twice as frequently, even with the same resumes as, whites are hired twice as frequently, even with the same resumes as people of color. This is also the case if whites have a criminal history. As most of you know, one of the biggest challenges in the rehab world is trying to help folks with criminal histories and seeking employment. But whites will have an easier time being hired with even a criminal history, and still hired twice as frequently than any individual that's Black with a criminal history. Again, this is the same regardless of education level. Again, if you add a disability, those numbers are going to continue to get worse. So when you look at wages, keeping in mind that that gap between the highest and the lowest is always getting bigger. That's been happening for quite a few decades. Just as an example, in 1979, the wage gap was between whites and Blacks was 18.1%. In 2015, it was 26.7%. So let's look at spending a little bit in some of these neighborhoods. In predominantly non-white neighborhoods, there is a decrease of grocery stores and an increase in convenience stores, and also an increase in liquor stores. So you have less income, and then when you do spend your income in your neighborhood, you have to spend more to get some of the same items and stuff. Look at credit. Credit is important for everybody. The Hispanic population is 78% more likely to be given higher mortgage rates. Blacks have a 105% increase in likelihood in getting a high mortgage compared to whites. This includes when credit score and debt to income is equal. Since 2013, auto lenders have shelled out more than $200 million to settle lawsuits for charging minorities higher loan rates. Have settled out more than $200 million in lawsuits because they were shown and proved to be charging minorities higher loan rates. These are bankers. Okay, so in November of 2017, both parties, Democrats and Republicans, they both agreed to decrease regulation on all financial institutions. It had previously been increased to help eliminate some of that, but then they were increased, or then the regulations decreased. So I don't know exactly what's happening now, but I'm assuming the stats will be coming out soon. So when somebody wants to say, yes, but I grew up poor, I don't have any privilege, yes, certainly less privilege than folks that are white in a higher socioeconomic status, but still more privilege than someone that's not white. And those are just a few examples. I could probably read stats for an hour or two of proven disparities between whites and people of color. So that intersection, one more thing I want to share, sorry. One of the things that we've talked about a little bit is, I guess we'll keep moving. Sorry about that. So white privilege intersecting with trauma-informed care and that systemic racism. So there are some historically derived economic benefits that whites have had compared to individuals of color. Going back a long time ago, all land in the United States was taken from Native Americans. much of the infrastructure that we now know and benefit from in this country was built on slave labor. Incredibly low paid labor or prison labor, sorry, built by slave labor, incredibly low paid labor or prison labor performed by men and women from marginalized groups. Much of the house cleaning, childcare, and cooking and maintenance of our society has been done by low wage earning women from marginalized groups. Even today, men, women, and children from marginalized groups still do the hardest, lowest paid, most dangerous work throughout the US. And white people enjoy plentiful and inexpensive food, clothing, and consumer goods because of that exploitation. So kind of go back a little bit in history. And in this country, even when the slaves were freed, it was actually fairly catastrophic financially to the Southern economy, which was built on slave labor. The majority, therefore, kind of had to shift for a means of finding labor to meet their needs. There was a small sentence in the 13th Amendment when that was passed that they utilized. The section in the 13th Amendment says, except as punishment for crime. Except as punishment for crime is built into the 13th Amendment. And so there's a belief system that began incarcerating minorities at higher rates. Minorities were being arrested for things very simply, just as loitering, and then being forced into labor so that they could help build our country. This is known as, you might have heard about it, the chain gang era. This was also the era of public lynching. Out of this, the Jim Crow laws, where Black people were freed but had no rights, it evolved. Communities of color were oppressed, segregated, and criminalized based solely on the color of their skin. The civil rights movement followed the Jim Crow period, but at the same time, there were some implemented policies which became known as the Southern Strategy. The result was vilification of actions from non-white communities and the criminalization and oppression of these populations. They all really kind of took a problem of economic inequality and poverty. There was more segregation, more drug abuse, and criminalization of all of that in the form of war on crime and drugs. The people in power chose to treat drug use as a crime versus public health. These policies were effective in getting the Southern vote and getting politicians elected, but they were also very devastating to minority groups of color. Remember that war on drugs? I think that we still kind of talk about it at some level. One example of how that war on drugs really impacted people of color much more harshly was in the sentencing guideline for cocaine. Powder cocaine, which was largely utilized by wealthy whites, had a minimal sentencing, while crack cocaine, which was largely cheaper and a drug of choice for people of color in the inner cities, came to be significantly stricter and longer sentencing guidelines, even though the drug makeup was the same, chemical makeup. This was also not just, again, not a Republican or Democrat issue. Bill Clinton's 1994 crime bill was considered one of the most oppressive pieces of legislation towards communities of color. This was that he had that truth in sentencing policy, which required prisoners to serve 85% of their sentence. Parole was basically essentially washed away. And this is where you got the 3 strikes and you're out. And this was also a $30 billion funding dedicated to policing our prison systems. It was also the catalyst for what we have now, which is more privatization of our prison systems. So, and communities of color began losing young men in large numbers to the prison population. 1 in 3 Black men will end up in prison, whereas it's 1 in 17 white men will end up in prison. So part of this whole process developed unconsciously, consciously, a fear and anxiety took over our country, that these criminals were taking over our streets, and fear of young Black males in particular evolved. And these policies really kind of tore families apart. So when you're looking at cultural narratives and trauma narratives, these can be very much a piece of what folks might experience as you're working with them. So part of our goal is to really truly understand systemic and institutionalized racism. We've all been hearing that a lot lately in the last months, and probably even a few years before that, but it's kind of surfaced a little bit more recently. And if you're really going to truly intersect trauma-informed care with a cultural viewpoint, then understanding that systemic and institutionalized racism exist is a really good start. And it really just means that systems and structures are in place, and they basically create and maintain racial inequality in nearly every facet of life for people of color. If you have to pay more to get your groceries, if you have less income but have to pay higher rates, or you get turned down for home loans, there's an inequality that's kind of hard to move past. So there's a complex interaction between culture and policy. And it creates those disparities in many areas where success indicators, including wealth and criminal justice system, employment, housing, healthcare, politics, and education, they're in every facet of day-to-day living. It really prevents us from making a more equitable society, and it creates more challenges that have to be overcome by marginalized groups in our society if they want to compete or reach a more equitable economic position. It's a few examples. I don't know if anybody's heard about the redlining. There is a legacy in our country, what the banks did and called redlining. It happened mostly in the 20th century. It has been outlawed, but there were neighborhoods that were predominantly from people of color, and those neighborhoods would get home loans at lower numbers. And so home loans for individuals that were racial minorities were denied. The result ended up that Black people made up nearly more of the homeless population. Despite making up only 13% of the population, they made up about half of the homeless population. Redlining was banned in 1968, but those areas are still those areas that were redlined are still today more likely to be lower income areas with higher level of racial minorities living in them. Those areas also tend to be less funded by tax dollars because there's just less funding, period, because there aren't enough institutions, employment, and everything to fund the tax base. So there tends to be less financial money for schools, healthcare, and transportation, which tends to lead to public safety concerns and over-policing. Healthcare is also, there's some disparity. There are huge, I guess I think it's been over a decade or about a decade since the disparity in healthcare large long-term study was produced. So people of color have less access to health care than whites. The level of uninsured for Hispanics is 34% compared to 13% among whites. Native Americans and Native Alaskans often tend to lack more prenatal care in the first trimester. Again, I could give so many more stats of the healthcare disparity. Nationally, minority women are more likely to avoid doctor's visits due to cost. Racial and ethnic minority Medicare beneficiaries diagnosed with dementia are 30% less likely than whites to receive medication that can help stave off challenges. And the list is fairly endless that impacts individuals. Microaggressions. I'm assuming most of you have heard of microaggressions. These are one of the things that typically are talked about in most presentations that talk about cultural concerns. Microaggressions are those everyday, subtle, some are intentional, most are unintentional, interactions, comments, behaviors that communicate some sort of bias towards marginalized groups and persons of color. They also occur to individuals with disabilities on a frequent basis also, but micro assaults are more intentional. They demonstrate an absolute bias and discrimination meant to cause harm. And then that's not the piece that we're going to really talk about. Another aspect of microaggressions is the micro insult and the micro invalidation. These are those unconscious comments or behaviors that we might engage in that minimize and marginalize people that we interact with. They are absolutely more dangerous than the assaults. They are not meant to cause harm. They are often unconscious. And people who give them don't know what they're doing. They don't know how they're hurting somebody. Unfortunately, they do take a really huge psychological toll on the mental health of all recipients, especially when, you know, most white people think about their race on a daily basis about zero. It's going to ebb and flow depending on where you're working and what's happening. But people of color tend to recognize and consciously think about their race 83 to 87% of the time. Again, depending on environment and where they're interacting. So this toll can really take an emotional toll and lead to some anger, depression, can really help decrease working ability and problem solving ability. 61% of employers report witnessing or experiencing some workplace discrimination based on age, race, gender, or sexual orientation. I know a lot of people don't always agree with the existence of microaggressions. Some folks might say that people are too sensitive or our society is too politically correct. Those responses don't really take into account that historical trauma. And take the viewpoint that history is in the past, we should just kind of forget about it and move on. Folks with that viewpoint may tend to engage in more unconscious micro insults. So let's take a little bit closer look at the impact.
DeLeana?
Yeah.
This is Laura, and I asked folks if they have examples that they feel like sharing so people
Sure.
can kind of read. So as you go through, some might be just typing some examples of what they've witnessed of microaggressions, and I love the micro invalidation and micro assault terminology. Thanks for introducing us to that.
Okay. So that intersection of the microaggressions is built upon some implicit bias. And keep in mind that people who engage in microaggressions are us. They are us, period. They're ordinary folks who experience themselves. We view ourselves as very good, moral, decent individuals. And microaggressions occur because we don't recognize what we're doing. It's really absolutely unintentional. So Daryl Wing Sue is a psychologist, and he's the one that has probably written the most about microaggressions. And his 2 cents is it's not the overt racists or the white supremacists or the Klan or the skinheads that is more dangerous. The outright bigots, he explained, are less likely to affect the standard of my living than individuals who are well-intentioned educators, employers, healthcare providers, who are unaware of their biases. So if I'm hitting you over the head with this, there's a good reason. So hang in there with me. And to be perfectly honest, I really say this in total honesty because I had to reevaluate everything that I believed and how I saw myself when I started teaching that multicultural class the day after George Floyd murder. I would have absolutely labeled myself, yes, I know, I'm informed, I'm woke, but I wasn't, not to the level that I truly needed to be. And I think part of the whole process is that we continually reevaluate ourselves. We'll talk more about that too. So this is kind of sometimes hard to hear, that the people that are intentionally harmful are not as harmful as you and I who might be unintentionally harmful. But that's absolutely what I'm saying, sitting here telling you today. We are more harmful than those that are known intentionally hurting. And you know, we're probably more familiar with when persons with disabilities experience it, you know, when they're called sweetie or honey or do things, and you know, somebody tries to help them without asking. Those are micro insults that basically send the message, oh, I got to take care of you. We're much more familiar with those, but when we take a look at how that intersects with culture, we might not be as familiar. In the last few months, I'm kind of like everybody else. I did a little bit extra reading, and there are two current popular books that are out there. One of them is So You Want to Talk About Race by Ijoma Aluo, and White Fragility by Robin DiAngelo. I've read both. I actually, if anybody wants to know or cares, So You Want to Talk About Race, I found to be much more helpful than White Fragility. I don't disagree with anything written in the White Fragility. I just appreciated the guidance more in So You Want to Talk About Race by Ijoma Aluo. Both authors have one thing in common, and they basically said the greatest threat to eliminating the systematic oppression of white women, or I'm sorry, the greatest threat to eliminating systematic oppression is white women who think they're helping but not helping, but it's also white silence. And I think DiAngelo probably framed it more in terms of white people who think they're helping, who think they're a part of the solution and problem. But most of us white people who think we're not. We are part of the problem, and mostly a lot because of white silence. We'll talk about in a little bit. So part of what both of these authors are suggesting is everything has to start with ourselves. We have to really truly understand ourselves. And if you think you've done as much work as you can since the George Floyd murder, I'd probably say you can probably do a little bit more. I know I'm still working on it. I'm still not where I need to be. I'm not where I want to be. So we really have to, the big focus, if you really want to do this and intersect with trauma-informed care, that understanding yourself is not going to stop for a while. And you really have to dig deep and not just do the superficial piece. Because once you do that part, both authors are pretty clear. Action is next. There has to be action afterwards. So that implicit bias, if you've not really taken any of the tests, Harvard has an implicit bias test. Once you get this, the link is there. But Harvard has an implicit bias test. They're very humbling. But microaggressions are really closely tied to the implicit bias, where these are the attitudes, stereotypes, and assumptions that we have that we're really not quite aware of. They're there, they affect what we say, what we do, but we're not always conscious about it. And the biggest criticism that people have is that, you know, when we're too sensitive. People are too sensitive, and being politically correct is getting carried away. But I want to go back to the beginning of what I said. Only the person who experiences what they experience can determine what is their lived experience. And so I urge you to think about that a little bit more if you really do think we're getting a little bit too sensitive and too politically correct. Read a little bit more, especially that cultural appropriation. I don't have time to talk about that, but we all do need to kind of double check our assumptions and our implicit bias, and really truly recognize that white silence is a part of the problem. I think we've all seen maybe less white silence since the end of May. think that was what was occurring most frequently, was much less white silence following the George Floyd murder. I think there were more white people recognizing that, yeah, you're right, systemic racism exists and we've got to do something with it. And that putting an end to these unnecessary deaths of people of color, especially when there's an intersection with police, is very important. And please hear me, this platform is not drawing any attention to some of that other chatter that's going on about this topic in general. But white silence is viewed by marginalized people as white consent. And to some level it is. If you don't use your voice, you are almost at some level condoning. So if voices aren't heard, then voices are assumed to basically agree with what's happening in our society. And we can certainly talk all day about what has happened, and not, obviously not all of it is needed. We don't need the riots, we don't need the property damage, we don't need any other people hurt. But the main focus here is on, we could never really agree, you know, if we all talked about this, we could talk all day, but we would still never agree on who actually is doing all the harmful stuff. But I do want to recognize that this behavior does interfere with kind of the main goal of helping people maybe not be as silent, and to recognize that if we truly want equality and to really truly welcome people into our agencies and have them gain that sense of trust of us and really promote equality, we've got to really kind of take this walk down towards not being and not having as much white silence. So I want to kind of take a look at a couple of examples of microaggressions. A couple things to ponder. Any comment about hair or clothing to anybody, just don't do it. Is your hair real? Can I touch it? Please, please, please never touch anybody's hair without asking, by the way. And by the way, don't ask. Any comment with the word inspiring or special, I think this is, you all get that it's really not a positive thing or real praise. And we hear that a lot with persons with disabilities, but individuals of color that might have obtained perceived higher level of education or be articulate often hears the same thing about how inspiring or how good or special they are in some way. Any comment that includes a term of endearment, honey, sweetie, dear. If any name is hard to pronounce, try not to ask somebody if their name has any meaning to it. And asking why someone wears particular clothing, such as a hijab or a sari, don't ask. Your job is to know what it represents and accept it. If that person wants to share with you any particular meaning for how they dress or how they view their culture, or what they need to consider as they're looking for a job and what kinds of accommodations, then that's when you can dive into specifics if it's needed. But in general, our job as professionals is supposed to know a little bit of this and not I mean, yes, please hear me, I'm still going to always ask you to learn from the person that you're serving what is culturally important to know, but some of those smaller things that everybody should have some broad understanding of, try not to ask. So how about some more examples? Color blindness has come up a lot, I think, and those are statements that indicate that a white person does not want to acknowledge race. Why can't we all just be humans? All lives matter. It's not just Black lives. You know, anybody that says, when I look at you, I don't see color, or America is a melting pot, or there is only one race, the human race. This is more of what we call an ethic perspective, and it's a viewpoint of the person saying it. It is not the viewpoints of the group being talked about. And on the surface, it is true. I mean, all lives do matter, absolutely. However, all lives can't matter until you truly understand that formation of Black Lives Matters. And please hear me, I'm not making any comment about Black Lives Matters. I'm using that as an example. And what we are all doing when we take that viewpoint is we're not looking at that person. We're not seeing who that person is. We're not looking at that person's experiences. We're expecting that person to assimilate into what we think is important and what we value. And we're not looking at that person as a racial or cultural being. And we've done this a lot. I know I have. I try to stop. I've hopefully done a good job. I know I haven't all the time. But trying to be more conscious about this and not engaging in this as we move forward, because all the persons that we serve, their ethnicity, their race, their culture is very much a huge piece of who they are. You know, and maybe in a rehab setting, part of that ethic perspective could also be thinking that all depression, schizophrenia, or diabetes occurs in the same way in all cultures, and that everybody's going to respond to diabetes the same way. And it's not. I mean, there's going to be different cultural variations of how schizophrenia might be treated, how epilepsy might be treated, and how diabetes might be treated, and how it's viewed within that culture. And this is very hard to discern, very hard to discern. I was consulting on a case this summer. One of our current online students is working with an individual, I'll probably forget where the person's from, but living with borderline personality disorder. And then there's some major cultural distinctness going on. And it was really hard for that office to kind of figure out the best approaches. So it took a lot of conversation and dialogue for me to even be able to help the office really kind of figure out a couple things, because as you might imagine, what I was hearing was fairly judgmental. They were trying to do the best job they could, but it was really challenging. And as you know, borderline personality disorders, period, are challenging. If you add some cultural distinctness, you're not always quite sure which you're dealing with most. So it was a very tough learning experience for all of us, and I think they're on a good path that they want to be on right now. So we don't get to decide what's typical or atypical. We got to be very cautious that we don't make those decisions about what's typical or atypical from our own cultural lens. And so that IMIC perspective, we really want to try to focus more on helping understand those individuals. Because that's what's really more important. Those differences that can be explored or understood and not assumed to be known. Any treatment or intervention, you know, kind of like any polarity. I mean, it's not that we necessarily want to adopt a 100% etic perspective or IMIC perspective. A little combination of both, depending on the situation, is going to be somewhat helpful. Some level of integration, a few steps along the way. So another one is denial of individual racism, a statement made when whites deny their racial bias. I'm not racist. I have several Black friends. As a woman, I know what you go through as a racial minority. It really kind of is denying that there's any privilege that somebody with white skin could have. And it basically means you're immune to races because you have friends of color, however you kind of look at those, but that racial oppression is really no different than, you know, gender oppression. I can't be racist. I'm just like you. I'm okay. This actually fits into the most devastating area for people of color. The individuals that don't think I'm not racist, but they still might be part of that white silence. And sorry, but we all have racial bias. My 2 cents is everybody here has a racial bias. So the fact that we have it is not the issue or concern. We just need to know what it is so that we can monitor it. Our job is to know what assumptions we make where it comes from, what we do with it, and we just got to monitor it. I hate to say this again, but I know some of you probably have already heard this from me, but one of the common phrases that people use is leave your biases at the door. I'll tell you to never leave your biases at the door, because they need to stay with you, because you need to monitor them. You need to be very much aware of them so that you can monitor them. Leaving them at the door assumes that you're not acting on them. And they're always with us. So it's that consciousness again that we have to avoid going on autopilot, because when all of us go on autopilot, we tend to be more unconscious and just do. So, all right, so what are we going to do here? So if you're going to really truly move into this realm of trauma-informed care with that cultural awareness and knowledge, what are you going to do? You really want to use your counseling skills to convey a level of understanding for what those folks that you serve experience in today's society. They're not expecting you to apologize. They're not expecting you to do anything except just be aware. Just somehow use your skills to convey that I get it. It has to be a little hard. It has to be a little challenging. Be able to make some comments to share that you get that this day-to-day life, especially even maybe now, is a little bit harder. What they might be experiencing in the employment setting, what they might be experiencing in the interview stages, and kind of be very cautious and don't, I guess, try not to assume that if and when you do this, that you're going to be immediately embraced, because the folks that we serve that are culturally distinct from us have had to find a way to survive in this society of massive systemic racism. And so it can be a little hard to absolutely embrace you right away. They may not believe that that's really what you're thinking or believe. So you may need to have several conversations and find a way to convey your level of understanding before that person is going to trust you more and start being a little bit more real and genuine with you in terms of what it's really like out there as they are trying to meet their goals and move forward. Be able to convey that awareness of those potential challenges. So if they're seeking employment, training, education, or even some medical assistance, I know your job might be primarily intersecting in a certain area, but one of the tenets of rehab professionals is treating the whole person. So recognizing that they might have these challenges with other professionals in other areas, is going to be incredibly helpful and build trust with you, for you. And you don't have to know everything that's going on. Just like, gosh, I can't imagine, what that's been like for you. Living, I've had one gal that was, I was working as a mental health counselor, and this person needed career counseling, and career counseling is one of my specialties. So she was already working with a therapist, and the therapist said she's not willing to take any responsibility. She's not really willing to do anything. So you take her. It almost said that way. And so I met with her and recognized she was culturally distinct. She wasn't originally from Eau Claire, and Eau Claire, Wisconsin, and she came from, I think, California, was originally born and raised in California. And so I made a comment the first time. I think it took three meetings with her before she's like, oh my God, you really do get it. It literally, I was kind of saying some of the same things over and over for 3 meetings before she could really open up and said, oh my gosh, yes. And I wasn't quite sure where it was headed. And then I kind of didn't want to automatically assume that she was trying to be what she thought I wanted her to be, which was everything's fine. Everything's fine. She didn't want to complain about white people. She didn't want to complain about those people. So it took a while to build that trust, and I can't say that I said anything on that third time that that helped her open up. I think it was just she had to get comfortable not pretending that everything was fine all the time. And so validating experiences is very important. The experiences that they bring to us, that they talk about, and try to validate with some empathy, you know, reflecting how hard, how rough, how sad that had to be for them, okay? And if you notice the language I'm using, how hard that had to be, how rough, how sad things might be, it's very specific to what might be said, because sometimes you actually might need to validate without agreeing. And I think the validation piece is really what I want you to focus on, because you can validate without agreeing, because there might be folks that you're working with that you don't want to agree with the story that they're giving you or the scenario that they're giving you, because there might be a larger level of culpability on their role or their behalf, but you still have to validate, because you're not going to be able to really truly work with that person unless you validate. But you validate without agreeing, and you do that just by simply reflecting how it might have impacted them in some way. You make sure to monitor your little tiny words you use. Yeah, right. You know, you try not to agree with anything, but just simply use that reflecting skill, and help them tell their story. For those of you that truly understand trauma, you really do kind of get that sometimes it's really hard for the brain to put language to what they've experienced. And so help them tell their story in any way that they can. Anytime they can sit and tell their story, especially if they've not done it with very many professionals or very many other individuals, it can be an absolute healing process. And you don't necessarily need to do much with it, depending on what they tell you, but allow that space and time to do so for them to tell their story can be incredibly healing. And I know you might not want to hear that, because it might take a little bit more extra time, but that process can allow you to help them heal themselves a little bit, because the more language they can put to their experiences, the better they're going to feel. It doesn't take away the experience. It doesn't take away the negative impact. But you also get to know them at a deeper level. And typically what you can almost filter out through that is some of the triggers that might come up that you can monitor as you're helping them move forward with their goals and objectives. I'm an absolute firm believer that the more time you spend up front getting to know somebody, as hard as it may seem, the more time you save later on as you really understand that person and can kind of help stop fires. So.
And DeLeana, this is
Yes.
Laura. Just a reminder to everyone that we do have the Q&A area if you do have questions, and that we are at our 10 minutes.
Okay, all right. So you also want to be the change that you want to see in your agency. Promote self-care, make room for folks to voice concerns, share ideas, be willing for you to engage in that ongoing self-evaluation. Yeah, I mean, I think you just got to keep getting deeper and deeper. And then engage with those that you serve to provide feedback on your agency's overall impact to them and maybe their family and their community. I know almost all agencies do this, but you might want to make sure that you're kind of taking a look at your mechanism that you do that can pull a little bit more over to that overall impact, not just the goals and such. So responding by putting cultural knowledge into practice and learning from the community and promoting cultural safety and well-being. You know, this thing called culture, there's such an intersectionality as the word is being used. And you want to help your agency show that you understand that trauma is going to arise out of an experience that could be an isolated event, but also from that systematic oppression, discrimination, and such. And help the folks that you serve understand that you get that trauma doesn't occur in a vacuum. The individual response to everything might be helpful based on how the community is responding, or it might be hurtful based on how the community, and community is family and or community, and how geographically things are going on. I mean, if you're paying attention to everything, I mean, Portland doesn't seem to have changed much, so you could imagine what folks might be experiencing in Portland right now, whereas maybe what other cities might be experiencing are going to be a little bit different. And yes, I do know something happened in Kenosha last night, but so some of this might be an ebb and flow in terms of what's going on and how people might be triggered more and what's happening. And so how that community responds and how much you pull the community into the process. And I know many of you do a lot of reaching out to community organizations and leaders. And when you really want to help build that trauma narrative and pull the community into the process, as you all know, it takes a lot of time to build those relationships, but reaching out to the community to foster that development with community leaders is absolutely vital. And they just need some time to get used to you and have those ongoing conversations. And your job is to just really never give up. Take that time and patience. And then recognizing how trauma impacts individuals directly, just really those cultural variations and those trauma narratives at the same time as recognizing your role and how your role might be viewed. So let's kind of take a peek at that. So the big difference tends to be between the individual cultures and the collectivistic cultures, because individualistic cultures view the self as mostly inadequate, whereas a collectivistic culture is going to really think that anything that they're not doing well is going to impact others. They're not really concerned about themselves. So an example, like if an individual victim of rape is shunned by the family, but that person still needs some solace and nurturing from their own culture, you can still help them find individuals within that culture that are not going to shun them, even though the family may have. So that helping somebody to connect culturally to somebody, even if a family has shunned them, is still very, very healing. And recognize that the expression of emotions and feelings is going to be very, very different within cultures. So, you know, psychoeducation is a huge piece of trauma-informed care, and it actually might be more so for those that are culturally distinct, because they may not know that if they're not getting it elsewhere, if they don't have trust in healthcare professionals, if they're not seeking mental health counseling services as frequently. So you just have to be cautious in how you do that, but you know, not all cultures are going to be able to identify that trauma explicitly, and some of them may expect you to know, which involves, especially from a collectivistic individual, more indirect conversations. So you do that by listening to those themes that come up as they tell their story, and your job is to try to help pay attention and hone in on those. And be very cautious with direct questions. I'm pretty sure most of you've received training on that, because there's many cultures, especially collectivistic, that direct questions are going to absolutely be a threat. So reflect more and help somebody just share more using your minimal encourager statements. So these trauma narratives are very important. Again, they do take a little bit more time, but they're going to be very helpful. And this is that intersection of the historical trauma, because it's going to include those memories that could include some reproduction of the events, or how that ongoing reconstruction goes with that individual of how they view the stories that they're being told. So as generations happen, the stories get told in a different way. And that the individual that you're working with might have a different viewpoint, but it's still usually meaningful to them. These often persist beyond the direct survivors, and they include how a teaching of event has happened, the traditions of threat, whether it's people, sections, agencies, collective self-identity, and fosters group cohesion and identity that really truly creates meaning, and really reluctant to close the door and past hurts because it's been survival. So please pay attention. Just because somebody's reluctant to close the door and past hurts, that has been a survival. It doesn't mean we all need to move beyond it and pretend it didn't happen. It just needs to be honored that it's there. and leads to a greater current understanding of the social environment. So that, again, kind of like what we just talked about, that patience and time to listen to the stories and allow them to evolve, are very helpful, even though that it's a much slower process. Your role, unfortunately, involves every professional that individual has worked with, because their survival has depended oftentimes on minimizing cultural differences, kind of like that story I told. So they may not want to be culturally distinct, so you have to have some time to allow them to get used to you recognizing it. Trust and truth may not be forthcoming easily. It has to be earned. And please, please, please never tell somebody that you can trust, that they can trust you, or show them that they can trust you. Don't tell them. A lot of trauma survivors have been told by individuals that hurt them that they could be trusted. So please never do that. Every individual coming to you is also coming to you with all of the hurts and or good stuff from previous professional relationships. So recognize that you might have to work a little bit harder because they just need time, and acknowledge those cultural considerations that might need to happen, especially if there's any geographic differences in your area, employment settings and such. And try to ignore the feedback that you get from other professionals. Like that example I gave you, I had to ignore what that counselor said to me. So a piece of this also is resisting re-traumatizing by focusing on resiliency. And what you want to do is help individuals adapt to the challenges. The consistent factor here to resilience is having that caring and supportive relationship. And relationships are really the healing piece. Most of the individuals that you serve may not have had that. And so you offering the encouragement and reassurance and compassion can kind of help somebody heal. Research is very clear that when somebody, especially a child, has experienced some negative impacts, whether it's their family or anybody, it only takes one adult to help them provide guidance and support that can really help minimize the impact of that individual. So you as an individual can actually be that person. So help your people adapt to challenges, figure out what their strengths are, what helped them in the past. It also includes recovery, but also that personal growth and surviving. Please, please recognize that resiliency is not something that they're born with or not born with. It is absolutely a skill that can be learned. So you want to help them make connections and healthy connections with other people, including groups, faith-based organizations, community groups, social supports. And it involves obviously conversations, and you might have to help somebody decide when it's good to walk away from family members. Help them find a way to recognize that crises are surmountable, that they can find some level of strength, whether they've used something in the past. Help them find some way to manage an hour-to-hour, day-to-day kind of thing, and help them build their steps that they can find. Help them understand that change is going to happen. We all experience change, and it's okay that everyone experiences change. And maybe the cycle that they're in right now is just a little bit extra. Part of this also involves a little bit of self-efficacy, that belief in self. So part of it is you want to help them build confidence in themselves and trust themselves to make their own decisions. Make steps towards goals. Rehab professionals are beautiful at this, absolutely beautiful at this, but you might have to slow down, and you might have to kind of really get some microscopic, creative goals in place to help them see that they are taking some level of positive action. And help them take action, as part of the trauma response. It's flight, fight, or freeze. If somebody stops engaging, help them recognize and help them minimize feeling overwhelmed. Slow down with them and help them understand, maybe with a little bit of psychoed, what's going on or what's not going on. And lastly, that self-discovery. People often learn more about themselves and they need to grow in some way. Better relationships, a greater sense of self, feeling, more vulnerable and being okay with it, a greater sense of worth. So help them find a way to learn from their experiences. Takes a little bit longer for some folks. Usually this is something that can be easy or hard. And find something positive about the self. Help them grow and get that confidence in themselves to manage the struggles and trust their intuition. Again, you can see that these all take some conversations, and keeping things in perspective. It's really easy to catastrophize when things keep happening day after day, week after week. So focus on one item one day. Especially a traumatized brain cannot handle a lot in one time period. So slowing down might be a little bit more microscopic. Trying to find some way to keep a positive outlook on something that they can do, one little tiny thing again. And then self-care, help them with self-care, and you have to have your own self-care. Sorry, I didn't do good time management there.
Well, great. That was fantastic, DeLeana. We really appreciate your time today to share all of this information. And I'm not seeing additional questions. So wanted to thank everyone for your participation. And again, a survey will go out along with handouts that will include the PowerPoint, as well as, I think, 9 other additional resources.
9 pages, yeah.
Yeah, but they're excellent. They're excellent. So those will go out. And so we look forward to your feedback. Hope to see you at a future training. And have a great rest of your day, everyone. Take care.
Thanks, Laura.
Thank you.
Thanks, everybody.